A few weeks back, we shared the story of a surrogate mother here in Idaho who carried and delivered a baby for Chinese parents who, due to COVID restrictions, cannot get to the States to retrieve the infant. Without a lot of options, that surrogate has been raising the child herself for the last 4 months. And as our Stephanie Garibay reports in tonight's update, this is just one of dozens of cases.
This is Idaho News 6.
Before the pandemic, there were already concerns over the surrogate mom ever taking care of the baby, mainly because of bonding concerns and the baby becoming attached to the surrogate mom.
Now, post-COVID, really the thinking is who better than the surrogate who has taken care of this baby for 10 months of pregnancy, who better than the surrogate if she has the means within her family.
This was the case for Emily Crislip, an Idahoan who became a surrogate mom for a couple in China. But after COVID-19 was declared a pandemic and travel restrictions were put into place, the biological parents have not been able to meet their own child, leaving Emily and her husband to care for the baby months after giving birth.
So their plan was to get here before the due date, and we were going to let them be in the delivery room, so they were going to be a part of it, see her be born. And so when she was born, they were supposed to get their own room at the hospital with the baby, and then my husband and I would have had our own room, and my job was done at that point.
The surrogacy agency has tried multiple ways to help speed up the process. They have even contacted government officials in both the U.S. and China.
Unfortunately, because this COVID matter is still very fluid, we're not getting straight answers.
And Emily isn't the only one going through this. The agency tells us since the beginning of the pandemic, they have had 30 cases of international parents not being able to pick up their kids, some being turned away at the airport with no reasons given.
The one thing that gets lost in all of these stories is the real challenges and the real pain and suffering that the parents are having, how much they've been through. And now that they ultimately got their most amazing miracle and dream of having a child, now they can't be reunited with the child.
In Emily's case, it is still uncertain when the parents will be able to travel to the U.S. to pick up the baby. But the surrogacy agency says it's ready to try everything possible.
We've had to be innovative and figure out ways where we can really accomplish all this and make sure that the parents know that their child is safe.
In Twin Falls, I'm Stephanie Garibay, Idaho News 6.